I just want to make sure everyone knows how to contact her. This font's a little small, but if you can't see it, www, where'd it go? Where'd it go? Hello, where'd it go? We're going to get Miriam's email and website. You're on LinkedIn? Great, okay. So how can we anyone find her on LinkedIn? Same name under LinkedIn. If you find her on LinkedIn, raise your hand. I want to make sure that we can find her and connect. MT Consultants are helping the way people innovate. So if you and your organization are struggling with innovation, they identify the people and they help them move forward. So really important to have these experts on your team involved, and thank you very much for that. I want to let you know that as we move along, if for any reason our timing starts to change, what happens is we have a screen up here for everyone on stage, and the time is showing so you have full visibility of how much time you have for your presentation. So I kindly ask for you to adjust it accordingly. We have to adjust everything as time goes over throughout our event. So thank you so much for being patient as we do that and just adhering to the time, or else I come up behind you. Okay, so we're moving forward fast on this morning session. We got a panel discussion. I don't want to waste any more time blabbing on, but we are talking about remote healthcare. Everyone's getting remote. These phones are more powerful than we think. And the solutions paving the way for a better digital patient journey is really at the forefront because everybody wants their health on their phone, right? So let's welcome to the stage Alice Veglio, who is the CEO and founder of Bright and Fit Fitness Program, who's going to be the moderator. You saw her up here earlier. Give her a round of applause. Thank you for the stage. Take it away.
Okay, thank you so much. It's such a pleasure to be to introduce such interesting panel. We know that the background of this panel is our daily life. What happened 2 years ago? Our life changed, and healthcare professionals had to take interest into technology because technology is not just a solution, it's a way to improve the healthcare system. In 2018, when I just graduated, I thought to do something different in my field. I was passionate about fitness. I was passionate about women empowerment. So the question was how I can give a solution to give accessibility to women from every part of the world to a better lifestyle. The solution was Bright and Fit. Bright and Fit in the years has reached more than 40,000 women that can add essence to an app, innovative app, in which is included fitness, nutrition, mindset tools. So today, during this panel, and I'm gonna call all the other panelists here with me, we are going to see how the experience of a patient from the prevention side and also from the cure side can be implemented with the innovation and technology. So I ask kindly to all the panelists to come here with me. Thank you so much. Okay, so the flow of today is going to follow three main aspects of the technology and how technology can help every healthcare professional to improve the experience of his patient. So the first aspect I think that is mainly important is accessibility. So to help everyone to reach his audience. So have the opportunity with technology to bring hospital inside the ISIS, to bring healthcare and also well-being inside the ISIS. So in my case, in my specific case, the solution was through the app. I created an app because we can reach the app with our phone. So what happens with everyone when everyone can reach an application anytime? It can stay committed, it can stay consistent. So if a patient or a woman can stay consistent on a healthy lifestyle, which is the results? The results, the improvement. So in this case, accessibility to an app, a digital platform can be life-changing. So what I'm asking you is to introduce yourself, and I'm looking at Rohini because she's working like me on the preventive side. So to offer all the tools to prevent diseases. So I kindly ask you to start and then share with the other wonderful panelists that are here with me today.
Thank you so much, Alice. Good afternoon once again. My name is Rohini. I am from India. We have a mental health company called The Able Mind. We work in the area of proactive and preventive mental health, like Alice was saying. And we've been in the field in this company for 7 years. I've been a mental health practitioner for over 22. Proactive and preventive mental health is really critical for us because, as you know, mental health is always looked at as a last resort for seeking help, right? So this intervention is what everybody knows, and when the problems reach a point of no return is when people sort of reach out for help. And the more you let problems fester, it results in all kinds of physical health issues, as Dr. Wisam will also agree that cardiovascular diseases, gut-related issues, all kinds of stress and burnout-related issues, everything can be prevented if only we figure out that, yes, let's talk about what's bothering us. Let's not let it eat us from within, which is why, reaching out on your own proactively to talk about what's bothering you is really important. That's the area that my company, The Able Mind, is really working towards, handling that particular issue of preventing problems before they become too difficult to handle. So what we say is that solve for the molehills and not just the mountains, because if you let it fester for a period of time, then you don't know what are the difficulties you're going to be dealing with. So I would like to pass on the mic to whoever would like to talk next.
Yeah, sure. Thank you. Well, I am Silvia Micalo. So I'm CEO and founder of Sunshineoxygen. It's a health tech company with headquarters in Spain and with applicability international. And as the two first panelists and Alice, the chair, what we do is solutions for patients. And in the end, it's what all of us do. And remote care, it's a core in this essence. And the fact is that there's no pathology burden unless the pathology is occurring. So we are all here to move the care until the early phases and the early stages of early diagnosis. That it's all what we do. And in these terms, I would say that patients should be the center of all what we do. This is what we do in Sunshineoxygen and all what all of us do, for example. But the thing is that we could say that the center of all what we do should be around patient empowerment, the empowerment of the patient, to make the patient more capacitated to understand his own healthcare condition and to be able to manage it with genuine and trustworthy information. Why not? Sometimes it's a simply matter of training the patient in the very early stages so that we can early detect his or her situation. So, well, this as a first introduction, and I move the word to my colleagues. So, please, Guy.
Good morning, everybody. My name is Guy. I'm the founder and CEO of GS Enterprises and also the CEO of MedConsult Group. We are established here in the UAE. Actually, what we are doing in the last years is locating startups, new startups, especially in the healthcare industry, because we understand that the world goes to new things, new innovations, mainly in the field of remote healthcare. We're involved in a few critical projects in the remote healthcare, mainly hospitals here in the GCC. The requirement is remote healthcare because during the pandemic, everybody understood that face-to-face healthcare is not the new frontier, is health remotely. And this is what we are doing, and I think that the world goes to those steps, and hopefully we'll find new innovations that can help everybody to do healthcare better.
Yeah, thank you, Guy. My name is Wisam Yassi. I'm an imaging cardiologist. Before COVID, I had a very lovely life, smiling the whole time, doing innovation mainly on CT and MRI and echo. But after COVID, we were confronted with challenges at the hospital in the Netherlands. I work at the St. Jansdal Hospital, blessed with one of the best systems in the world, the Dutch health system. The challenge was exactly what Guy said a few moments ago, telemonitoring. It was pressing, so that led me actually to start a company called the Med Company, because created by a doctor, that's why, just like the coffee company, then well, Med Company. And we created a telemonitoring app to monitor patients at home with actually two of the best people I know, my best friends, and we got it regulated. And we connected multiple devices to the app, and then we connected the app directly to the EHR of the hospitals, and we presented to a wide range of user cases, from heart failure, which is my main concern, rhythm disturbances, post-myocardial infarction, COPD, post-COVID, and these user cases. One thing about the insurance companies, starting next year, telemonitoring going to be reimbursed in the Netherlands. So not all what the insurance companies are doing are bad. So it's a very bright future, and we are expecting innovation much more in that direction. So I would be more than happy to talk to you about the possibilities after the session or during the session. Thank you very much.
Thank you. I'm Jignesh. The fundamental question is, who actually likes to go to a hospital, right? Every patient, especially in an acute setting, wants to be treated at home. And that essentially was or is the genesis of kind of joining healthcare and having this company. We started with prevention. So we started with health kiosk, and the difference there was medical devices were connected via Bluetooth. Comes in COVID, and it just accelerates the pace and the adoption as well. So we kind of got into telehealth pods and the periphery from a tech perspective, which includes the platform integration and various plug-and-play modules. The adoption saw an increase. We thought where we were struggling from a prevention perspective, stakeholders started engaging more and more. The space that we are in right now, it has eventually evolved into remote patient monitoring. Again, it means a lot different to a lot of people in different markets. We've just entered US end of last year, and being in that market has essentially given us a better understanding of what actually can be achieved through digital health services. And again, I believe technology, not only from a software perspective, not only from a technology perspective, but even otherwise, plays an integral role. If anyone has a doubt whether this technology, all the innovation that's happening in the medical space, it can only evolve and it can only accelerate. So happy to share more experiences about remote health monitoring in general.
Hi, last but not least, Ritesh Patel. I work for Fin Partners in New York. My colleague Goel is here as well from Israel. So I have a completely different view. First of all, I'm never as accomplished as this lot right here next to me. But what I do is look at consumer behavior. We are all used to using our phones. We are all used to using QR codes, right? You want to order something in a restaurant nowadays, you have to get your phone out. So our behavior has changed. And I think we in the healthcare industry need to get rid of the words remote patient monitoring and just say we are going to provide care to a patient where they need it, how they need it, when they need it, because we have that capability. We're about 5 years behind, in my view. I think the adoption of digital by people, not patients, is huge. And you're already doing it. So why don't we fit into that workflow? I don't get up in the morning and decide I want to be remotely monitored. I get up in the morning and say, I'm not well, so I use my phone and I call the doctor, because in the US, Wisam, it's the best medical help money can buy, I think, right? So better than the Dutch. Only kidding. So, I think we here and you guys out there need to think about this more from a how do we provide care to the patient when they need it in the form that they can get it, rather than saying it's remote patient monitoring or it's rural health or it's, whatever. The only thing that's standing in our way at the moment is infrastructure. There's a lot of infrastructure requirements, and there's a lot of countries that are doing that. So thank you for allowing me to be on the panel, and I'll talk to you later, by the way.
We're going to do that.
Yes.
It's very interesting because we understand from what this interesting professional told us from now is that technology is not just the solution, it's the implementation, is to take care on a better way of the patient, because the patient starts to be comfortable on taking care on himself, to try to provide a different kind of lifestyle. So technology is not just the quickest solution we can find after the pandemic. It's a way to adapt our nowadays world to new needs. And a second aspect that I think that will be really interesting is the implementation. How technology offers us the opportunity to give something different. From a side, the first challenges I found is that fitness is not easy. I don't know how many of you train daily. You can raise your hand. Okay, some of you, but training is not easy, right? Because you have to reach the gym. Doing the diet is not easy because it's not the easiest choice we have. We have one apple, we have one pastry, we choose the pastry, right? Okay, so my challenges was to make it interesting, make it easy. So I decided to implement inside my app new tools that I call gamification. So how to make it fun while training. So all my subscribers are earning badges. So after you train, you earn badges. It makes it interesting because after that, you want the certification. You want to earn more badges. So it's a way to make fun something that is very helpful for patient, and is a way also for me to cooperate with healthcare professionals. So we found obesity, we found many heart problem, heart disease that need the help of other professionals to change the lifestyle first. So yeah, in my case, gamification is a way to improve through technology the experience of patients. Also, giving the opportunity to have some masterclass in my case is a way to reach as many people as possible, 2,000, 3,000 people per time, to give information, to give not just an experience of understanding the tools to feel better, but also to have a better knowledge. So I don't know from your side how the technology can give implementation in your field. So if you want to share, will be very, very interesting.
Yeah. So similar to what Alice was saying, that gamification is a way for her to reach out to her audience. One of the things we do at the Able Mind using our app is get people to talk about their issues. So we have different options apart from anonymous chat that we actually, we get people to talk about. We have counseling conversations with our team of qualified mental health professionals, which takes care of helping them resolve their daily issues. But apart from that, how do you create awareness? How do you create people to, talk about their issues? We help them share. So we have on our app, it's called the Able Mind app. It's available both on Google as well as on Apple iOS phones. Our QR code is there on page number 52, which I'm insisting to say once again. If you look at it, there is an option called Your Story and Mine, where we are encouraging everyone, mental health professionals, layman users, people who've had experience caregiving people, those who have health issues, mental health issues, physical health issues, and those who have individual, lived experiences with problems, to share their stories, talk about it, write a, share a letter, share a poem, share an audio, share a song, anything, talk about it, so that, people all over the world who download the app know that, okay, I'm not alone in this. that's where digital tech comes in. The reach that you have, the power of technology, like Ritesh was mentioning when he got the award, that if it moves, then digitalize, right? I mean, isn't that what you said? Yeah. So, which I think is very significant, because if it's possible, you should do it, and that's the only way you can reach people. That's the only way you change the social narrative. You use the best of tech and the best of human experience to make life better for everybody.
Indeed,
Would you agree?
Indeed, I absolutely
Yeah.
agree with you. And the thing is that both of you have crystal clear examples of preventive medicine. And this morning I raised a question here in the room, and it was, how can we make healthcare more sustainable and affordable for everyone? Because why we are here if not? So I think that the enablers, it's us. We are making it possible. How? Through digitalization. And how? Through health tech. We are here creating the solutions that will enable more sustainable healthcare systems. Our solutions, in the end, are going to be integrated in a healthcare system and are going to help the healthcare systems of the future to be more sustainable. The house, through prevention medicine, through creating healthier habits, through catching the pathologies in the very early stages, and with all the solutions that you are sharing with us, and myself also in Sunshineoxygen, also we are creating solutions in these lines, creating these better healthcare outcomes of the future. Because we are creating not only technologies, but we are creating validated technologies, clinically validated technologies. Because it's not only about saying, okay, my solutions does this, does that. No, it's about operating since the very beginning with best practices and creating solutions that at short term can be applicable and consolidated in a region area, but in the near future can be scalable. And how is possible this? By, since the very beginning, considering the highest standards of care. The highest standards of care, and when I say highest standards of care, it's not only about speaking about security, it's about best practices in tech and best practices also in development and security, but also clinically. Our technologies need to be clinically validated, and they need to demonstrate what they do by healthcare outcomes. And this, it's going to enable the sustainability of the healthcare systems of the future, the circularity be implemented, not only the take, make, and dispose, but also the fact of recycling what we have by synergies of collaboration in between us, in between public and private collaborations, by recycling, reusing, and redistributing. It's not only about me, my region, my country, it's about thinking globally. We are changing the model, the healthcare model. So let's think big since the very beginning, since the conceptualization of the technologies. And we need to embrace and integrate the healthcare professionals when we design the technologies, because they are the ones that are in the field. They are the ones that are touching the patients. And they are the ones that know the real unmet needs that will bring value to our technologies. It's not about launching technologies and again, and then getting pools of technologies. It's about getting technologies that really bring value. And if I find another technology that brings the same value as than I do, why don't learning about these best practices, learning by others, and going together and doing better? Because sometimes we can bring a lot of value in what we do. We are speaking about remote health, but let's look at the countries, what the ones that are leading this remote health care, what they are doing. Maybe they are just integrating a matter of training in their health remote. So sorry, because I'm standing so much. Sorry. Thank you.
Cross-border collaboration. You're from Spain, you're from India, you're from Holland, right? Singapore. There's a lot going on at the moment that everybody can take advantage of. Yeah. Same in the room. Yeah. But the only thing I'll say, Wisam, is the radiologist is going to be replaced by AI, right?
Well, I don't think so, because cardiologists, do you follow The Hard Guy on TV, the series? It's the most watched TV series by women, I think. So cardiologists won't be replaced by artificial intelligence.
Just asking.
artificial intelligence is going to help
Maybe in the
us.
future.
They're going to help us because we have to implement the technology to the people which they need it. I'm going to tell you something. September 2021, something has changed. The European Society of Cardiology has introduced for the first time telemonitoring, non-invasive home telemonitoring in the guidelines.
Wow.
So please go and Google it. It's right now, it's class 2B, which you could do that and you couldn't, but you should actually consider it for your patients. This is the same class of indication when the CT and MRI was introduced in 2011. And right now, both of them, they are class 1A. So it's randomized, evidence-based, good technology to diagnose patients. This path gonna be the same for telemonitoring. Just mark my words. We are changing fast.
But are they changing the standard of care as part of that? Is there a regulation around, okay, we'll allow telemonitoring, but then the standard of care will
Yes,
have to change as well?
May I comment on that? Since May 2021, all the telemonitoring apps in the Netherlands, they should meet certain criteria and should be CE marked. So they are been treated as medical devices. And this is also the bottleneck for many startups and companies. If you pass that, you have like, the starting point to the market. We did the process by ourselves. And right now our app, Medcore4U app, is CE marked. So it's officially a medical app. And we can introduce it in the market. It's a good way of regulating things to reduce the smoke in that aspect.
That's very interesting. I think that the implementation is something that is touching every kind of field. And as we are running out of time, what I'm asking you is that we have understood that digitalization is the best option, but it's not easy. It's not always easy. From my side, the challenge is to differentiate, have the certification. We got the medical certification, but it's not easy. You have to provide high quality service or also the patient data. So what you think about these challenges, how you try to provide a solution in this case and how you face these kind of challenges?
I believe the biggest challenge today in the healthcare space is the widening gap between an increasing need for affordable patient care and a decreasing clinician supply. And that is essentially what needs to be tackled, right? The approaches from governments and from regulators, if we have to kind of just think a couple of years back and now, it is changing tremendously. There's so many initiatives that are happening at government levels, and healthcare is something that no country is able to kind of, avoid, and a lot of initiatives are being taken place. So the talk about certifications, there is a positive approach while it's required, and it's difficult, but there is more engagement from all stakeholders. That's one change that I've seen over the recent years. And patient education. The patient is far more demanding and far more aware. Something as, say for example, the patient security, someone mentioned about patient data. And a couple of examples, and there are so many examples of patient data breaches that's happening that it needs to be tackled adequately. So I think unless and until, and again, it's an evolving space, but these are areas that needs to be considered properly, however painful it might be for some of us. But I believe there's good progress happening in that space as well.
True, for sure.
Yeah, I think that because I'm dealing with a lot of startups in the last years, I can see that we can tell that the main problems that we're facing is patients that are still afraid of technology. If we're going to present an idea that you can 4D an organ and print it in a printer, then you can implant it in one of the in a patient, then patient goes nuts about it. They're afraid of it. This is an example of one of the companies that we are dealing now. It's not just to help patients; it's also to control patients, to educate them, and to let them know that technology is nothing to be afraid of. Especially in the healthcare industry. We have to, we are 21st century, we are going there. I think that the pandemic made all of us a huge leap in the understanding the needs of the world in the healthcare. And I think that education and for patients, and not just patients, also for caregivers, is very important, and we have to deal with it strongly and independently.
But Guy, don't you think user experience has a lot to do with it? I mean, there are so many crappy health apps out there, right? Hundreds of them. If you made the user experience better, why do people order Uber? It's a one thing, right? The user experience is there. I think some of the problems we face in the healthcare industry is we look at healthcare, not the experience. We approach it from how do I want to do it as opposed to how does the patient want to interact with it. And if we can fix that piece, I think the fear of using apps or digital health will go away. So that's one thing I would encourage us to do.
I don't want to tell you that sometimes, sadly, I can tell you that a few of the products that are out there are not what they're actually saying that they are. Yeah, I'm speaking gently. But still,
I'm not that gentle.
But still, we do have a lot of apps and products and companies that they are actually doing something new and innovative in the world. And with those companies, we have to stand behind them and to educate people and to educate caregivers to promote them and to help them to go, in the world.
Thank you so much for sharing. And yeah, I agree with you, Guy, because the technology is not just about educating people, it's just educating ourselves, entrepreneur, professional, to face future challenges and try to provide what we want the most, so the best experience for our patients. So thank you so much for sharing.
Fantastic
Thank you.
panelists. Health 2.0.
Thank you so much.
What a great panel today. Hate to rush you guys, but I'm sure everyone's getting a little hungry. I want to open it up for one or two questions. Is that okay? Anyone ready to ask some questions? Come on up to the microphone. First one wins. And just be a gentleman, let the ladies go first, probably the best. We got a tiny few minutes of time before we take a huge big group shot we're gonna go downstairs to do. So I invite you to the mic.
Hi, good
morning.
afternoon, everybody. This is Dr. Sarah, the Medical Director at GEMS Education Corporate. My question is, as the innovation and the technology is rising, which is amazing, my only concern would be patient privacy and confidentiality. The information is going all over the network. This is my only concern. And the second one is, as a co-founder of a telemedicine clinic back in 2021 in University of Sharjah, at first, during COVID, it was amazing, it was working, everyone was accessing the service. However, post-COVID, I noticed that patients started to prefer to come to see me in person, and to, telemedicine clinic is not that beneficial as in person. So what do you think we should do to promote the telemedicine again? So privacy and promotion, health promotion, to use the telemedicine. Thank you so much. It was amazing. Thank you so much.
Thank you for raising that. Before we start, I don't know if you saw, I got a little cut time there. Who wants to answer that question? Just by a show of hands. Someone have some answers? You got some answers? Okay. I'm going to invite you to take this conversation actually to lunch. And I only ask you to do that because we're running low on time, right? But I appreciate you coming up here. I know there was another question out there. I'm not going to invite you up yet, but I would like to get to you, okay? And I want to make sure that you get to the people up here on the panel today. So do find them during lunch. Again, I want to give you a round of applause. These conversations have to continue off stage, but thank you very much for all your expertise today. Really fabulous. Thank you, thank you, thank you. Now you know who to find. I know some of these guys are up here on stage getting those recognition awards. Oh, one panel picture. Can't go anywhere without a picture these days, right? Make sure that you're here. So what we're gonna do, if pictures, if you haven't gotten in a picture yet, guess what? All 6 events are going downstairs, down the escalator. Once you walk out these doors to the left, down the escalators, out to the water. We're in Dubai Festival City, which is across the street from Jeddah. This is a creek where the history is that, thank you so much, everybody. Their history is was pearl trading, and this is where it was all happening. So you're gonna go downstairs on the water. Everyone's gonna take a group shot together picture. And then once we get that picture, they open up the buffet for lunch. There's a number of different stations, so everyone can enjoy a delicious lunch by the Intercontinental. We love that you're here. That was the beginning of first round of our first day. We got a lot of stuff to do. Thank you so much for being a part of Health 2.0, guys. I'll see you downstairs. Let's get down there so you can be tagged and share that you were here and making history in Dubai today. Thank you again.